Good morning, good afternoon, or good evening, depending upon when you are watching this video. My name is Irene Jones, and I am chair of the nursing department at Owens Community College. Within the department, we have an LPN certificate, we have an LPN to RN bridge program, and we have the traditional RN program. I will very briefly talk about what nurses do, talk about our curriculum, and then I have a couple of videos to share with you. Since we are unable to hold this on campus currently, I did want to give you a little insight visual as to what our labs look like on campus and what you can potentially expect as a student at Owens in the nursing program. So first of all, the first couple slides on this PowerPoint do discuss the Ohio Board of Nursing Law and Rule, because I think there are some misconceptions with nurses that what we do is we pass medications and we perform skills. Unfortunately, there is a larger part of nursing, and a lot of that comes with the psychosocial aspect of nursing. There are physical aspects of nursing, but we also need to develop clinical judgment skills also. So as you look at what the law technically requires of nursing, the Board of Nursing requires that we provide safe patient care to our population of patients that we care for. And it also regulates nursing programs to ensure that we adhere to the guidelines, the laws and rules put forth by the state. And as you can see, there will be a common theme through a lot of this. As far as teaching goes, a big part of being a nurse, whether you are an LPN or an RN, is the practice of teaching to your patients. Healthcare nowadays has a large portion of preventative care, so we need to make sure that communication with patients happens from the very beginning before they are hospitalized, and try to prevent that hospitalization. So what does it mean? There are differences between registered nurses and licensed practical nurses, or an LPN, based upon the Ohio Board of Nursing's Practice Act. So nurses, as far as a registered nurse, they are able to assess their patients, whereas LPNs gather data and they provide that information to the nurse or to the doctor who's caring for that patient. So there is a slight difference in the role that they play as far as what they do related to the patient's care. RNs, like I said, they are able to assess the patient. They are also able to determine a nursing priority of care. So what that means is that we are taking the information from our patient's illness or illnesses, depending upon what we're caring for them for, and we develop what that primary focus is going to be, so that as a nurse, we're able to help them get better in that area. The nursing plan of care is passed on from nurse to nurse, determine interventions, and then evaluate, and we may have to modify those interventions. The RN works collaboratively with the interprofessional team, which can be comprised of respiratory therapists, STNAs, OTAs, PTAs, the physicians, nurse practitioners. It depends upon what area you're working in and what the patient's diagnosis is. In contrast, the LPNs do not assess the patient. Instead, they collect the data. So they collect the data, they report it to the RN who is overseeing their care, and then they help to determine that priority nursing diagnosis so that they have an integral role in working collaboratively with the RN. They also assist with the interventions. They work with the direction of the RN to perform specific skills. They do not evaluate and modify the care plan, however. They are able to make recommendations on that evaluation and that modification based upon what they have seen of the patient and what their care has provided to the patient. A common misconception that I have found with students is they believe that going through a nursing program makes them a registered nurse or a licensed practical nurse. That is not accurate, and I try to squash that from the very beginning. In order to be a registered nurse or a licensed practical nurse, not only do you have to complete an Ohio-approved program, you also have to take a national credentialing exam known as NCLEX. So there is the NCLEX RN and there is an NCLEX PN. And what that means is that when you have completed your program, hopefully at Owens, then we send a letter of completion to the Board of Nursing. You work with the Board of Nursing and Pearson VUE, who is the testing site, and you schedule your time to take the NCLEX. Right now, there have been modifications made due to the COVID-19 pandemic. However, under typical circumstances for a registered nurse, your exam can be up to 6 hours, and it would be anywhere from 75 questions to 265 questions. They do evaluate it, and you are notified, I believe, within a week of whether or not you pass. The same holds true for the PN, except there is a minimum of 85 questions. Like I mentioned, there are current changes right now due to the pandemic. However, those are not permanent changes, so I will not be discussing them. But I do think it's important to remember that completion of the program will award you an associate's degree or a certificate. However, it does not make you a licensed nurse. You do have to pass your NCLEX in order to do that. In Northwest Ohio, typically registered nurses are working at the bedside in the hospital as a starting position, and typically LPNs are working in extended care facilities or in medical offices. They will work hand in hand with the medical assistants and the STNAs, whether it's in the extended care facility or the doctor's office. Starting salaries for an RN is about $58,000 depending upon where you work. An LPN can be about $45,000 depending upon where you work. Again, doctor's offices, extended care facilities, and hospitals are all going to have different starting points for their salaries, and they all will have different progressions through the rankings, I should say, for the salaries, depending upon experience. Here at Owens, for our LPN certificate, we start one cohort a year. It's on the Toledo campus in the fall. It is 3 semesters. So you go fall semester, spring semester, and then you complete in summer. So you typically August. You do have to maintain a C or better in order to progress through the program. And you do have to have a C or better in all program courses, which includes the general education courses, in order to progress and complete the program. If you do not achieve a C or higher in one of the courses within the curriculum, then you would be required to repeat that course. The maximum time to complete the curriculum is 2 years or 6 semesters. And like I mentioned, we start on the Toledo campus in the fall. Once you complete that program, then obviously you will schedule and take your LPN NCLEX, become licensed as an LPN. Most, I would imagine, would be out there working. And then if you're interested, you are able to apply and be admitted into the LPN to RN progression program. This program is 3 semesters long. You are awarded advanced credit based upon courses that you have completed in your LPN curriculum and your LPN license after you complete NUR 110 within our curriculum. NUR 110 is a transition course that builds upon the current knowledge you have as an LPN. You have 5 semesters to complete once you have started your NUR courses. And just like the LPN curriculum, you must maintain a C or better to progress through the program and complete the program. A course that does not earn a C or better does have to be repeated. The traditional RN program, we have 3 years to complete this program. And let me go back real quick. The LPN to RN progression program, they admit in the fall on the Findlay campus, in Toledo in the spring semester. The RN program does admit on the Findlay campus and the Toledo campus, both in the fall semester and in the spring semester. So there are 2 cohorts starting each year. The RN program has 3 years to complete from the time you take your first NUR course. Just like LPN and LPN to RN, you must maintain a C or better in order to progress through the program and in order to complete the program. Clinical opportunities. We traditionally have clinicals in both, or actually I should say all 3 programs that start out the very first semester of your curriculum, and we go all over the place in Northwest Ohio. When it comes to your precepting opportunities, we may branch out into Southeast Michigan with some of the ProMedica hospitals in that area, depending upon what is available at that time. Long-term care facilities are more focused for our PN students. They will spend 1 semester in the long-term care facilities and then move into the hospital setting. Our RN facility, our RN programs, they spend a majority of their time into the acute care setting, which is the local hospitals. One of the things that we have been seeing lately is the change of clinical to lab hours and using simulation as part of the completion of clinical hours. That is approved by the Ohio Board of Nursing, and given the current state of the pandemic, we have had to do that. We are hoping that moving forward, we go back to traditional clinical opportunities so that everyone receives the full hands-on care opportunities that are provided at the facilities. The Ohio Transfer Module, I'm only going to talk very briefly on, but when you complete your RN program here at Owens, that awards you an associate's degree. We do have articulation agreements with many four-year colleges so that you can complete a bachelor's of nursing very quickly. Many of these programs are online, so you can do them while you're working or while you have a family, and many of them are condensed into modules. There are programs that will complete in as quickly as 18 months. The requirement is typically completion of an ADN program, general education courses, and then you're able to complete the nursing program at the bachelor's level. So there are many opportunities for you to do that. Not only do they have the online, but they also have the on-campus programs at various schools also. Professional growth, I think it is important to remind students that as you come into the nursing profession, nursing growth, nursing education does not stop once you earn your license. We are continuously held to standards that change, and we've seen a lot of that in the past few months. In our field, we have continuing education that is required as a registered nurse. However, not only can you continue on for your bachelor's degree, there are advanced degrees such as a master's in nursing. You can have an education track. You could have a nurse practitioner, which is a master's degree. Recently developed as a doctor of nursing philosophy. CRNAs, certified registered nurse anesthetists, certified nurse midwives are just a couple of the examples that you can have as furthering your professional education. Most have additional scopes of practice that adheres to the Board of Nursing and allows further application of that nursing knowledge. And obviously with an increase of degree and an increase of responsibility typically comes an increase in salary also. Work options, RNs make up the largest portion of healthcare professionals. There is a common misconception that when you're in a hospital, if you're a female, you're a nurse. If you're a male, you're a doctor. That is not true because there are plenty of male nurses. There's a big push for male nurses in the workplace. And also nurses work interprofessionally, as I've mentioned previously, with the entire healthcare team. So RNs work, as I've mentioned, in hospitals, nursing homes, physician offices. However, physician offices typically are medical assistants or LPNs. LPNs do have less of job opportunities. It depends upon what state you are in and what the status of the hospitals are. Mentioned before, many LPNs are hired into extended care facilities or the medical offices. I think it's important to remember that as a nurse, you can do so many things, either as an RN or as an LPN. We've seen that exhibited currently with the pandemic and the need within our health departments and the state health boards because of what is going on at the current pandemic level and the education that is needed. So really, caring knows no boundaries. We need all the nurses that we can get. We want to get out in front of a potential nursing shortage down the road, and we would encourage you to explore the nursing program at Owens if you have an interest. My contact information is on the website. My name is Irene Jones again, and so are the pre-nursing advisors or the pre-LPN to RN advisors or the pre-PN advisors available in order to help you get started with your academic career at Owens. I would like to share a few videos, as I mentioned earlier, about the tour of Heritage Hall. Heritage Hall is the location where the nursing program on the Toledo campus is housed.
We're here in Heritage Hall where our School of Business is located. Our School of Business incorporates programs such as sales and marketing, management, office administration, as well as insurance studies. logistics, supply chain management, lots of programs in our School of Business that are offering great careers in in-demand jobs. Our health programs are very popular here at Owens. Not only do they offer great jobs when students graduate, but as they are here, they get plenty of hands-on training and experience in the field. Our School of Nursing, located up here inside Heritage Hall. To the left, you will see our RN Skills Lab. Back there, it is set up very similar to a hospital setting, with a nursing station in the center, as well as different wings. Further down this hallway, we have some additional labs. They are our human patient simulator labs. In these spaces, these human patient simulators can do everything the real human body can do. In the far bed, we have Victoria. She is our birthing simulator. And we also have a number of different human patient simulators for gender and size. In this one, we have a pediatric patient, as well as all the equipment that a human would be set up to. Oxygen, an IV drip. This is our practical nursing lab. In this space, you will see additional mannequins with some equipment next to them that may just be the arm or the chest cavity, whatever those students are working on that day to study and be more prepared to enter the field of nursing. An additional space in Heritage Hall is our office administration lab. Not only is it a part of our School of Business, but a lot of other programs or areas of study do use our office administration lab for a number of other tools to learn. We have many tutoring centers here at Owens, 7. This is our accounting tutoring center, an important part of our School of Business. Our culinary arts program has a Terrace View Cafe. Meals are put on a semester basis, and students get experience waiting on tables, washing the dishes, taking the orders, and producing the meal themselves, pending where they're at in the program. And our culinary department wraps up with our baking lab. This baking lab is set for anywhere from 10 to 12 students and set up just like a kitchen you would see in Cupcake Wars or other great American bake-off shows. This student lounge, a lot of activities take place in. All of our student lounges are equipped with kitchenettes. These kitchenettes help making commuting to campus a little more feasible. The rooms along the outside of the perimeter of this space are individual study rooms, maybe used for large group study sessions or individuals who just need quiet in this space to study.
Welcome to the Human Patient Simulation Lab here at Owens Community College. Throughout your time here at Owens, you will be spending some of your time in the HPS lab. You're probably wondering what happens here in the lab. Our goal is to provide you with a safe, exciting learning environment in which you will experience a wide variety of simulated clinical experiences, what we call SCEs. These experiences will allow you to practice your clinical decision-making skills, therapeutic communication, and apply skills that you have previously learned in the college lab setting. Here in the lab, we challenge you to think like a nurse. There is no acting here. In simulation, you are the nurse. You think like a nurse, and based on your clinical judgment, you make decisions as a nurse that will impact your patient care and safe outcomes. Did you know that 50% of novice nurses are involved in errors? 65% of those errors are due to clinical judgment and decision making. The HPS lab is a safe place for you to practice those critical thinking skills. If you make an error, that's okay, since this is a place to learn from those mistakes.
That gives you a brief overview of what our labs on the Toledo campus have. The Findlay labs are set up similarly. There is a skills lab and a simulation lab also. Please don't hesitate to reach out with any questions, and I hope to see you in the nursing program in the future.